is the following. That cruise that ended on the 21st, that same ship set sail a few days later to Hawaii. That cruise ship is making its way back towards the state of California, specifically back to the city and county of San Francisco. It was due to arrive this evening. That ship, we've requested to be delayed, the arrival to be delayed, and the ship is currently off the coast. And currently, that ship is now being delayed to provide ample opportunity for the CDC, partnership with Coast Guard and with state health officials to conduct tests, because we have a number of passengers and crew members that have developed symptoms on this cruise ship. It's a Grand Princess cruise ship. As a consequence, we are going to be flying testing kits to the cruise ship, and we are going to be sending those quickly back to the state, primarily to Richmond lab, where we'll be able to test very quickly, within just a few hours, those samples to determine whether or not these individuals that are symptomatic just have traditional cold or flu or may have contracted the COVID-19 virus. We also will expand the testing protocols to even more passengers, as there are a number of passengers that held over from the Mexico trip and made their way on to the second cruise into Hawaii. So we're availing the testing protocols not just to those that are symptomatic, but also to address some of the anxieties of those previous passengers that are holdovers on the second cruise. So we're holding that ship, which is thousands of passengers as well, off the coast, and we'll be conducting those tests. We're getting those test results back. We are working very collaboratively with the federal government and the CDC on the manifest of those passengers that disembarked in the state of California, particularly, as I said, those residents. And that sort of led ultimately to the conclusion that a proclamation of a state of emergency would be appropriate under the circumstances. This proclamation, I want to point out, is not about money. It's about resourcefulness. It's about our ability to just add tools to the toolkit. We are well-resourced in the state of California. I cannot say that enough. Oftentimes, when you do a declaration of emergency, particularly on wildfires, it's to draw down federal resources. We already are the beneficiary of an announcement that we received today of $37 million of emergency grants that are forthcoming in the state of California. This part of the $8.3 billion appropriation that was approved by Congress today. And as you know, I've mentioned on multiple occasions, the state always anticipating the need to set aside emergency dollars, had $20 million set aside in our emergency fund. We're working with the legislature to get clarity on the ability to utilize those dollars. But we're early in the fiscal year, and as a consequence of being early in the fiscal year, people have ample budgets in this space. So again, money is not the issue for the state of California, but we are very blessed by the federal response and the good work of Speaker Pelosi and our congressional delegation to allow California to be well-positioned and well-resourced at all levels of government, not just the state, but substantively local level, to address this challenge head-on. So that's a lay of the land, broad strokes. It is a dynamic situation as it relates to the cruise ship, but nothing that should be alarming. Appropriate protocols are in place, and as I said, the ship will not come on shore until we appropriately assess the passengers and appropriately assess the protocols and procedures once people make it back on to state land, state property. We are working closely with the City and County of San Francisco, the Port Commission, and of course the mayor and mayor's office, and are grateful for their support and for their reasoned response to this. And as I noted, I want to just acknowledge that with 53 tested cases positive, this is no longer isolated in just one part of our state. This is broadly shared as a burden and responsibility up and down the state. And I want to thank local leaders, including those that today, I think wisely and appropriately advanced a similar proclamation in the city and county of Los Angeles. Many other cities have done the same over the course of the last few weeks. One of the provisions of our proclamation of a state of emergency allows for the ability for the local emergency declarations to extend without having to constantly be updated, as is the case under statute every 30 or 60 days, depending on the jurisdiction. This would extend those as permanent through our executive order, or rather through our proclamation, and more broadly, the stated goals of that proclamation. But one final point I want to make, and that is something that is being highlighted. It's a point of consideration and concern, and that is price gouging that we are seeing. As you may have noted, we are seeing literally small hand sanitizers like this going for much as $17. I've seen some online for even more. That's unconscionable. That's usurious. And we need to go after those that are price gouging, not just for hand sanitizers, but medical supplies and other equipment. This proclamation substantively allows for that to be addressed with the kind of urgency that is appropriate for the moment at the level of the Attorney General. There'll be a consumer alert going out to make sure that we are aggressively monitoring that kind of price gouging. And I just want to the extent it's of interest, I want to acknowledge Amazon to their credit. We were critical of some of how their platform was used and some of these products that usuriously were priced. Amazon immediately got back to the state of California and are working cooperatively to go after those that are taking advantage of customers that utilize their platform. That's the spirit which we were hoping to see, and we hope other platforms provide similar response and responsiveness to address the price gouging that we may be experiencing, not just in this state, but across the country. So that's the update. I am here with the team that we have assembled, Dr. Galley, Dr. Angel, that will talk more specifically about protocols and procedures. I want to just make one final point, and that is we remain very pleased with our federal partners. And I say that because it needs to be said. We are well resourced as it relates to tests now. That was not the case. That was a point of critique, of concern in the past. But we have over 5,904 tests as of this morning that we can access with absolute confidence that will draw down as those tests are used and conducted. We're able to draw down more federal support in that space. That's just an important update because that, again, remained a point of concern just a week or so ago. Now it's a point of compliment as it relates to CDC allowing the availability of those tests, as well as the addition now of 14 labs in the state of California that are allowed to conduct those tests. That number will increase over the course of the next few days. It's 14 today. I expect that number to go as high as 20 in the next number of days. And we are also looking to resource our incredibly rich university system and research system and the protocols and procedures and incredibly well-established work they're doing in genomics as well to amplify those efforts. There'll be more on that over subsequent briefings, but just know every resource in this state is being tapped in that respect, and we are blessed to have a wealth of those resources here in the state of California. So with that, I'll move it over to Secretary Galley, who will talk more specifically and update you, and of course we're here to answer any questions when we're done.
Thank you, Governor. Mark Galley, Secretary for Health and Human Services. I want to start by sharing my deepest condolences on behalf of our entire agency with the family of the patient in Placer. We knew this sad day would come. We are not unprepared for it. Today's proclamation does prepare us even more than we were before. We are able to more methodically work in a consistent way across the entire state with those health partners that the governor mentioned, whether it's the hospital systems that we all trust, the providers and the clinics in the community, or our public health partners across every single county in the state. The ability to push out consistent guidance around many of the issues that we know we need to be prepared for comes with this proclamation. The ability to continue the ongoing work with the CDC and other federal partners to assure that we have access to the federal stockpile for supplies when Californians run short is a very important assurance that we have, as the governor said, enhancing our toolkit. The ability to work with the most vulnerable populations as we learn more about COVID-19, and the fact that older Californians are more vulnerable than younger Californians, that specific populations that don't easily isolate or have easy social distancing measures, we are standing and preparing to provide some of those solutions. So in aggregate, we know today that COVID-19 is still a disease that most people who get it do not experience severe symptoms. But we recognize that in certain regions and in certain populations, they do experience more severe symptoms and require our hospitals and our clinical delivery system to be prepared for that. We continue to work on our pandemic plan for the state, modeling exactly what we expect to see in the days, weeks, and months to come, and preparing for those scenarios. We are working hard with the specific hospitals in counties where we're seeing cases now, and preparing to work with additional hospitals and systems across the state as we anticipate more cases to emerge. Issues like the cruise ship and today's important development with being able to work with more local partners with specific lists of patients or people who may have been exposed to individuals who are positive for COVID-19 becomes easier because of the proclamation. Reaching back out to the federal government for supplies, personnel, and funding is an important part of what we are doing now. I want to thank all of our public partners in the local public health departments. They have been with us along the way. The governor mentioned the great relationship with all of our federal partners. That continues. Regular calls with the director of the CDC and all of his leaders on how we assess our situation, how we ensure we have all of the supplies, and using the best knowledge across the nation. The governor mentioned the wealth of knowledge and interest we have among our very innovative Californians. We have welcomed a lot of great interest and ideas, and we are working with a number of people across the state to make sure that our already robust system can be as great as California can expect. I want to remind you that COVID-19, although we are here talking about our first death, that we know so many people who are going to be positive will not be this sick or nearly as sick as many of the folks we're reporting on in the press and in other reports. That we continue to urge people who are wondering if they are infected, who have mild symptoms or even moderate symptoms, to call their public health department, their provider, their hospital system first, so that they can receive guidance as to whether they should come or whether they should stay at home. And that if they do come, that we're able to accept patients in a very specific way, so we know that we keep staff, our facilities, and the patient as safe as possible. There are a number of other things that Dr. Angel will raise in just a moment about common sense things that we continue to urge people to do. And so despite this turning moment in our effort and response, we continue to feel confident about our approaches, about the information we receive, our partnerships across the state and across the country, and we look forward to ongoing updates as we invest time and energy into pushing out guidance to folks across the state, not just those in the health delivery system, in the public health system, but to all Californians so they can stay abreast with this important situation. And so with that, I will turn it over to Dr. Sonia Angel, State Public Health Officer and the Director of the California Department of Public Health.
Hi, thank you very much. As mentioned, I'm Dr. Sonia Angel. I'm Director of the California Department of Public Health and State Public Health Officer. I want to start by offering my condolences as well, along with the governor and Dr. Galley as well, to the family members and loved ones of our patient who passed away from COVID-19. As public health officials, we had hoped that California could be spared this loss, but we've been planning and preparing for it, for the possibility of it, for a long time. Currently, as mentioned, California now has 53 confirmed cases. These cases do spread out across the state, but I want to really emphasize that for the health of the general public in California, the risk remains low. I know and I acknowledge that in Placer County this morning, the local health official noted that the risk in that community increased. This is a quickly evolving situation, and just as infectious diseases move across different populations at different rates, that indeed is also happening here. So while the risk to the health of the general public in California remains low, I encourage you to pay attention to notices from your local health authorities regarding the risk in your community. We will also alert you as risk changes in communities over time, but this is also not unexpected. As always, there are common sense precautions that we recommend that everybody take to protect themselves. These are things that we've been taught for a long time, and they apply here and now as they always have applied. And that is that you cover your mouth when you cough or you sneeze, you wash your hands frequently, and if you don't feel well, stay home. That's good for you. It's also good for your friends and neighbors, for your fellow employees, and for all of us. As Dr. Galley mentioned, I also want to just emphasize that if you don't feel well and you're concerned that you may have symptoms of COVID-19, that you indeed call your health care provider or your county health official first. Do not go directly to the hospital. It's very important, or to your doctor's office. It's very important that they understand your symptoms and they can advise you from there what the most appropriate thing is to do. Thank you.
Thank you. And I want to bring up our OES director, who will talk about our pandemic planning and the tabletop exercises that are underway and the work we're doing to run scenarios on surge capacity, on procurement strategies, logistics, and the like, to give you a sense of the totality of our preparedness as it relates to this issue.
Good afternoon, Mark Ghilarducci, and Governor's Emergency Services Director. Let me just start off by first joining the other speakers, offering our heartfelt condolences from the men and women of the Office of Emergency Services to the gentleman that passed this morning. Let me begin by saying, in the overarching efforts of coordinating the state's response and supporting the lead agencies, the Department of Public Health and our Health and Human Services Agency, we have brought together the various elements of the state family across all the state enterprise, begin the process of evaluating the existing pandemic plans, reviewing the capacities and the capabilities that exist within the state family through our partnerships with private sector and through our partnerships with local government, in our ability to make sure that in the various phases that will be occurring in the coming days and weeks, that we remain out in front of this particular situation as it continues to evolve. We know that this is a complex and evolving situation, and each day we are getting new information, but we're also anticipating that information so that we remain in a place where we are ready to respond effectively and in a coordinated fashion by pushing out appropriate supplies and commodities. And then in the event that more broader activities or actions need to take place, we'll be ready to message those appropriately and support the communities and all of the public in California at large. Our State Operations Center was activated on Monday. We're going to be broadening that State Operations Center activation by tomorrow. Our federal partners from the U.S. Coast Guard and FEMA and the CDC will be embedding with us in our State Operations Center. There are a number of local operations centers that have also been activated. We're supporting those local emergency operations centers with coordination calls and information. We've actually deployed personnel out to embed with those local emergency operations center. And we've received proclamations from at least 9 counties now throughout the state as they are responding to events that have taken place within the community associated with COVID-19. We're regularly doing conference calls with all of our both public health officials and our emergency management directors throughout all the counties in the state. And we're coordinating closely with our fire, law enforcement, and emergency medical services partners to ensure that they have all of the critical guidance and information that is necessary. And we looked at and are updating all the existing guidance we have to meet the current circumstances as they continue to evolve. Again, remaining out in front of this, being able to push out guidance, and there'll be continual guidance coming out for public safety, for schools, for healthcare workers, et cetera, through the Department of Public Health, et cetera. Over the last couple of days, we have begun to actually provide commodities to local governments that have made the request, predominantly N95 respirators for healthcare workers and other public safety personnel. We'll continue to do that, but there's a multitude of other cascading and complex needs, and so we are working closely with our local governments to meet those as necessary. Let me just close by saying that this is sort of a marathon, not a sprint. We're going to continue to be positioned to basically respond accordingly, and we really I ask that all Californians listen to your local public health providers. Make sure that you follow directions of basic hygiene, hand washing. Make sure it's a good time for all families in California, individuals, to check their emergency plan. Make sure you have supplies, the things that are necessary, like we normally talk about here in California. You live in sort of a disaster-prone state, and so we always talk about preparedness, and it's a great time to review your personal preparedness plan. With that, I'll turn it back over to the governor. Thank you.
Just 2 additional points, and we'll happily answer any questions. Obviously, it needs no explanation, particularly with the difficulties and tragedies that have occurred in, north of us in our neighboring state. We are particularly focused and overlaying disproportionate amount of our energy on nursing facilities, senior centers, other congregate living facilities as well, for people with developmental disabilities and the like. I was pleased to hear Vice President Pence speak to that as well today. So it's a focus frame of urgency for the federal government, certainly is from the state of California's effort, and we are working very closely with our partners in that space, as obviously the vulnerabilities are much more acute for our seniors. I also want to make a point, someone who spent roughly half my life in Placer County. It's a large landmass, it's a small community, and I know how impactful this has been, even beyond the direct impact of family members have lost a loved one and friends to that broader community. And so we are very sensitive to the needs of rural California and rural communities, and we recognize our unique responsibility to do more to soften the edges and to make sure that we're present and prepared to meet their needs as well. I want to extend that because we also have another case that we are monitoring very closely in Sonoma County, an individual that apparently was on the same cruise that is in very difficult condition. And I can't comment more specifically than that, except to say we have one other case, an individual on that previous cruise that apparently was with this gentleman as it relates to that trip to Mexico. It gives you a sense of the enormity of weight, the human toll that this virus can take on the most vulnerable. At the same time, I'm a father of 4, and having spent a good part of my day with my children yesterday at Sutter's Fort, dressed in appropriate historic garb, talking to teachers, talking to parents, talking to other children. I I have great confidence in our capacity to meet the needs of our children, and I recognize, as all of you and all the experts do as well, that we are in a position we can confidently say, based upon what's happened around the rest of the world, that our children, healthy, younger people, are in much better shape to withstand this virus than older individuals that have other complications. And I just say that again as a parent to calm the nerves of those that understandably are anxious. Final point. We are assessing, because I inevitably imagine you'll be asking about issues of social isolation, issues around our sense of safety of people being in large crowds and the like. We're not in a position to make any pronouncements or directives or recommendations in that space as it relates to the current status of the virus in the state of California. As I said, it's taken many shapes, and all of them, I'll repeat, all of them were anticipated. And all of them have occurred in the kind of sequence that has given us an opportunity not only to prepare, but to respond. And so I just want folks to know that none of this takes us, sadly, by surprise, including the tragic loss of life today in Placer County. I'm pleased that the task force, the federal task force, will be convening in Washington State, and we look forward to continuing our work in partnership with the federal task force, and again, the remarkable partnership that we have well established with the CDC. We're happy to take any questions.
Governor, any further consideration of more emergency regulations on cruise ships or ports along the California coast? I know you have this one cruise ship being held off the coast, but the conversations about after that?
Yeah, I mean, clearly, we would be neglectful if we didn't consider those protocols with a different sense of urgency. I mean, there's just the magnitude of having a manifest with thousands of individuals, of which a majority are residents of the state of California, and of course, then the rest all across the country, for that matter, around the rest of the world. That's in addition to the number of crew on this ship, I think, do require different protocols and procedures and consideration, particularly in ports of call like the state of California, up and down our coast, and obviously other parts of this country. So that is certainly being reviewed with a deeper sense of urgency in real time. And I can assure you there's a reason that we didn't want the ship in the port of San Francisco in the state of California this evening, as was anticipated earlier. And we are working very closely to establish those new protocols in real time.
Is there a timeline or a goal to have the Grand Princess fully assessed and tested?
Yeah, we'll be able to get the testing kits out there very shortly. We'll be flying them out off the coast. As I said, we're now into a turnaround of roughly 4 hours for testing. We have testing facilities just right here in our own backyard. We have multiple testing facilities, but the one likely to be utilized happens just to be in Richmond. We'll be able to get those tests back. We have a few hundred that we'll be sending out in the first tranche, and we're working very closely with the CDC on establishing those protocols, Coast Guard as well. It's not our jurisdiction when individuals come in to the state, into our various counties, then it's in our jurisdiction, but it's certainly in our space of partnership and spirit, and we are going to have much more clarity on those that are symptomatic, whether or not they have contracted the virus or not, and we'll have a much better sense of what to do next.
And otherwise, how long do you think the ship will be held?
Once these tests are conducted, we'll get those back within hours, and then we'll make an appropriate assessment. And the current status of the ship is off the coast. It's a day at least out in the natural course. So even if we decided to give them a green light, we'll have additional time. But this will provide as much time as needed to secure the safety of everybody on board, secure their health, and then more broadly, the community that potentially could be impacted by thousands of people disembarking and then going to many ports of call through airports, large and small, not only throughout the state of California, but all across the rest of the United States and around the rest of the world.
Governor, have you done passengers who have already returned to the state and were not still on that ship?
Yes.
Are there concerns about whether we can actually contain this?
Well, as I noted, there's 2 individuals, one that tragically lost life, another that we're monitoring that we know were on the ship, that were on the manifest, confirmed. And we are monitoring. I think you may have heard of a number of people from Placer County, particularly, were on a tour that were on the bus coming off the ship, off the cruise, and so those are particular interest. And I want to just let the folks know they may be watching this on the evening news themselves, learning about tragic death of someone they were on the cruise with that may not have been contacted, to contact their local health department, and we will quickly assess their needs and provide the appropriate support. By the way, I want to remind people one of the more significant announcements was made today as it relates to the essential benefit now of a lab test. That's been an impediment for people that don't have resources to want to even access the test because they can't afford it. So I want to remind people in the state of California, our Medicaid in California is Medi-Cal. If you have Medi-Cal, it's reimbursed. If you have Medicare, it's reimbursed. If you have a private health plan, it's now an essential benefit. It's reimbursed. That is very significant. So people should not feel any anxiety about requesting and demanding the test. And the reason we are so focused on tests is we want point-of-contact diagnosis made available everywhere. And getting these tests out, not only the kits provide multiple individual tests, and getting those across our health delivery system is critical and gives us a better sense of what we're up against. Accordingly, there will be a point in time where it'd be nice to do community surveillance so we can more broadly assess community at large, not just individuals that have symptoms that are requesting the test. We will not know the scope of this until we broadly test, not just individuals that self-identify themselves as in need of a test. And I think this is a critical next phase and part of the conversation everyone should expect we'll be having. But we have the resources, we have the capacity. By this evening, we will have contacted every county health official that has someone that came off this cruise that has appeared on the manifest. They will have their contact information, and they will begin the process to contact those individuals. That is not an easy job. I'm not naive about the scope of quite literally hundreds and hundreds of people, but we have the capacity to do it. Sorry, Dad, was that?
Do you believe people should take cruises these days? Are you recommending?
Let me answer that question in about 48 hours when we assess a little bit more of the facts around this. Look, there's obviously heightened anxiety, and that's heightened anxiety that we are quite familiar with in the state of California as we repatriated another cruise from overseas that experienced a similar outbreak and then quarantine. So this seems to be self-evident, more of a trend, and I think it's going to be need to be dealt with head-on by the federal administration. And if it's not, we will certainly assert ourselves much more aggressively.
Did everybody that was on the cruise from Mexico, all of those passengers got off and the boat was completely empty, and then it turned around and went to Hawaii, or did some people stay?
Some people stayed. Number of people are being stayed. So I mentioned the number of passengers and crew that have self-identified themselves as having symptoms. Could be cold, could be flu, not all necessarily any with COVID-19. But there are a subset of the passengers, very small in terms of the total. We have estimated anywhere 50 to 60, but give us some room on that as we get more details, that stayed over. Obviously, we'll want to test those individuals I mentioned. They would like to be tested as well. We don't know yet the number of crew members that may have transitioned, and we're getting that information in real time. We just are now in receipt of the manifest, and we are sharing, again, that manifest with local partners and also sharing the workload with our federal agencies. And in real time, that information will be coming back, and we'll be able to answer that more specifically.
Just to clarify a couple details about the cruise. So it's currently a day out, you said, and is docked?
Well, we anticipated it was going to be docked in the city and county of San Francisco at its port later this evening. We requested that be delayed, and I think, and not surprisingly, that's the case. They're not nearby. They're not just right outside the Golden Gate. They're not just sitting right off the pier. They're quite a distance out on the coast. And so I give you a rough estimate. But, every moment. I imagine they're making their way closer, but they will not dock out in international waters, but they'll be a distance away until all the testing and the new protocols and regimes are put into place to secure then their arrival. The question is, where do they arrive? There may be new protocols and procedures that send the ship to another location. We'll make that determination in real time. We have no basis to which to suggest that anyone has deviated from the original port, which is San Francisco at this moment, but we'll determine that based after the testing.
And so there's 2 people who were on the ship who have tested positive for coronavirus?
For the previous cruise
Okay.
that concluded on February 21st, that went from San Francisco to Mexico. That same cruise ship then moved passengers out. We'll see how many crew. And then they had a subsequent trip to Hawaii. And now they're making their way back from Hawaii. And now we have a number of people that are symptomatic. And then, of course, this tragic death, another individual that's in very difficult position, in tough medical condition, that have only raised the alarm bells and requested, as a consequence, we've requested that the ship sail. So
how many are symptomatic?
11, 10 is the current, 11 passengers, 10 crew. Now that number, by definition, the dynamic nature that is the novel coronavirus, COVID-19, is subject to change. So forgive me, that's the number we have as of a few hours ago. That number may significantly understate. It may indeed be abundance of caution, because we don't have the benefit of how they are self-identifying in the medical crew that's already on the boat and their protocols. But again, those will be the ones that we prioritize for testing, and those tests will be made available as soon as our I assume it's helicopter lands or other aircraft that he knows more about than I do, makes its way to the ship.
Can you say how many tests you plan to send out?
We'll have a few hundred. We'll have whatever they need. We have available, as I said, we have 5,904 tests available in the state of California as of this morning at 14 labs. And we are confident that we'll get those replenished in real time. And if we need more, we'll get them. So as much as they need, but 200, I believe, was the estimate of the first round. Is that correct? Yeah.
Governor, there was a CDC release talk about a 3rd cruise ship passenger, not the Sonoma, not the Placer. Are you familiar with that, or does anybody have more details on that?
There are a number of people we're monitoring, and I don't want to say more than that except to say, by definition, we're going through that manifest, and obviously the concern around people being on a tour that all traveled together, not just on the ship, but also were transported together, highlights the need to focus with more acuity on those that may have been in closer contact with the individual that tragically passed away. And so we're monitoring that cohort with more specificity, and that may be the person you're referring to.
Along that line, that individual was back on shore for 8 days before, got back from the cruise before went to the hospital. Any estimate on how many people might have been contacted then, or concern over how to handle those?
Yeah, I don't have that specific information, doctors. I don't know if you do as well at this point.
No.
Yeah.
We don't have those specific numbers right now because the numbers are changing constantly as they continue the outreach of each contact to make sure that people are notified and then indeed risk assessed and testing if necessary, depending upon whether or not there are symptoms present.
Time for a few more questions.
So can you tell me, first of all, when the first symptoms started, and then are the people that are currently on the ship that's docked right now off the coast under quarantine? Like, how are they making sure that things aren't spreading on the ship currently?
Yeah, that's, they're, and forgive me, they're not docked, they're not quarantined, they're on the ship to the extent they've been isolated from the larger passenger and crew. That we don't have the details of. But again, those are being assessed, and that's been triaged on the boat. They have medical support on the boat, and obviously in partnership and advice and counsel from the CDC and their guidelines, and with the new testing protocols and our guidelines that will be well established and in place by the time these kits arrive, those will be determined. We'll have greater clarity quite literally in the next 24 hours on that.
Governor, last week you said your administration was possibly identifying other parts of the state where you could intake people who, need the help that could be at risk of this. Is that work still underway, and have you identified any other parts?
Oh, yeah. Look, Here's the good news. To the extent it's good news, it's all, it's just an update, perhaps. That's not even news. We have roughly 80,000 beds in the state of California, plus or minus. We have surge capacity that's well established from a protocol perspective, anywhere from 15 to as high as 20%. And we are assessing that surge capacity at a granular level. But in addition to that, reason for this proclamation of a state of emergency is not to alarm, but to enliven our capacity to assess other surplus sites and property. We first look at triaging those individuals that are currently in the system as the top priority. If you're looking to get an elective surgery, perhaps depending on geography and determination assessment, we may ask you to delay that for a moment. If you don't necessarily need to be in an acute setting and you're in a campus-like setting, many of these hospitals associated with other buildings, we would look to assess that capacity. Then we would get into more focused areas of looking at, for example, mothballed facilities. There's a number in Northern California, a number very large ones in Southern California, large hospitals that are in incredibly good condition, that have struggled financially or in parts of a current merger or litigation, looking to access those sites. And then, as I spelled out in this proclamation, we are looking at state facilities, fairgrounds, and the like. So that gives you a sense of the totality of the inventory that we're looking at. We're well positioned, I think, to address even the more extreme planning scenarios that we are processing. Yeah.
So is Fairview back on?
Fairview seems to me relatively minor part of the totality of what we're looking at. It may be, but there's an injunction. There's, it's not off the table, but our table is significantly larger, I assure you, than Fairview. It seems rather small in hindsight.
What about Sonoma State Hospital? Is Sonoma State Hospital?
We're looking, I don't want to prescribe any specific because there's a process to which we adjudicate the benefits and we don't want to surprise people. And we're looking organically bottom up for that assessment. And the reason why is the protocols that are already in place require these surge assessments to be part of local pandemic planning. So they already have their protocols. They'll present those to us. We'll adjudicate them, we'll aggregate them, and we'll help prioritize them. So that may not be part of the larger menu.
Today was the airport protections with the screener, the health screener down in LA. Any steps on that individual? Any concerns about the potential spread from aircraft?
Yeah, I don't have any specific information about that individual, and none of us do at this moment. We're happy to update you on that as it avails itself. The information does. With that, we appreciate your attention, and we'll see you soon. Thank you, guys.